Hey everybody, it's Dr. Gampolo, and I want to go over the process of back pain. So when you're having back pain, it's quite terrible. 80% of the population is going to have back pain at some point in their lives. 32% of the population is going to have neck pain at some point in their lives. Those statistics are really high. So back pain is a huge business. Now, why do I say that? You can turn on the TV, you can watch any commercial. Somewhere along the way, there's going to be some type of pain medication that is going to be presented to you. Whether it's an aspirin, Tylenol, or a prescription. In fact, what makes the United States unique is that we're one of the only developed countries in the world that actually allow for prescription drug companies to advertise to people directly. What does that mean for you if you're dealing with back pain, neck pain, or other ailments like chronic discomforts? It means that there are products available, but I want to go over what those products mean and the systems in place in order for you to get better. Now, step one for most people is going to be taking something over the counter, and be careful with what you take. When you take those medications, if you take the prescribed amount, there are side effects that can occur, including messing with your liver, your kidneys, or GI upset. That's actually the most common. About 10,000 individuals go to the hospital per year on average due to gastrointestinal bleeding due to NSAIDs. Now, that's usually the first place where most people start. I'm going to go buy something over the counter, and I'm going to mask my symptoms. All right. Now, masking symptoms isn't going to address the underlying cause of the problem, nor is it going to fix ultimately your back pain. Now, step two of the process is either doing physiotherapy, physical therapy, chiropractic, some form of natural holistic treatments. Actually, that has actually been shown to be the most effective form of treatments for back pain. Believe it or not, natural holistic approaches with some repetition and therapy has been shown to be the most effective form. Another option that patients will sometimes take is going to the emergency room in urgent care and getting a prescription. Usually the prescribed treatment for back pain is going to be a muscle relaxer, an anti-inflammatory like we talked about, maybe something stronger, which I'll get there, or some x-rays or an MRI. Okay, so objective findings, and again, drugs to help mask the symptoms. The third process is many times seeing an orthopedist or a neurologist, and let's face it, those guys aren't cheap. They're specialists, and to sit down with them, those visits can be quite expensive. The options whenever you go down that road, seeing a specialist is going to be many times injections, and I want to make this very clear, I'm not opposed to anything that makes you feel better. I've had thousands of patients over my career, and within that time frame, I've had many patients who have had to have injections or who have had to have surgery. It does happen. Now, is that what we want for everybody? Absolutely not. And most surgeons don't want that either. They understand the risk that comes with surgery, and they understand the risk that comes with injections. They want to help you just like we want to help you. When it comes to the injections, usually they're going to do anti-inflammatories or something to help with the pain, to help it manage the discomfort. Now let's get to the last option, and that's when it's chronic, and let's face it, probably the worst option there is, which is opioids. There's an opioid epidemic. It's killed over 400,000 people over the past 10, 15 years. It is a big problem, and it's something that most of us have seen. You can turn on the TV, heck, you can watch Netflix, and there's something that discusses about opioids, the addiction of opioids, and how it leads to methamphetamine issues or other drug issues down the road. I can tell you firsthand experience, I've taken 3 opioids in my life after I had hand surgery, and holy cow, not only is your hand not in pain, or your whole body, your mind is not in discomfort either. You're completely zonked out, and those drugs are powerful, and they are very addictive. So for many people, that's the worst route you can go. Now, if that's an option that you have been doing and you're not seeing results, by all means, you can try something doing more holistic or natural approach like chiropractic care. Many times when we see patients, we're actually the last resort, which is crazy, which means that they've gone to the hospital or they've been to their doctor and they've pumped themselves full of drugs, heck, maybe sometimes injections, even surgeries. We see many patients post-surgical where perhaps maybe it's not working out the best they possibly wanted, and now they're going, hey, you know what? I've tried these other options and I want to try this chiropractic thing. Let me see what this is about. I want to make this very clear. Chiropractors have one of the highest satisfaction ratings of all medicine when it comes to back pain. Now, let's discuss satisfaction ratings and what that means. We can't guarantee results in medicine. We've all heard stories about a doctor that did this or that. Of course, there is no guaranteed result. You can have surgery and not end up better. In fact, you could possibly end up worse. You could have injections and not end up better. Same goes for any form of medicine. With chiropractic treatments, what they find is that we have about a 95% satisfaction rating. And that's the one rating that we can control in medicine, is keeping you satisfied and keeping you happy. And so with our treatments at our clinic, we strive to have over a 95% satisfaction rating. Are we going to be able to say absolutely 100%? No, not necessarily. There is no guarantee with anything in life when it comes to medical. But we can try our absolute best to address your back pain, address your underlying cause of your condition, and try to get you from ultimately discomfort to pain relief and to ultimately wellness.